Hi everybody, it's Rabbi Mark Fishman here. Welcome to the Synagogue with No Walls project. You might have previously seen me outside of a supermarket here in Montreal. Today we'd like to take the project in a different direction and go into the format of having interviews with people within the community. Today, this month is October, and it's been dedicated to Mental Health Awareness Month. And we're actually going to be hosting a Shabbaton in a couple of weeks on Friday the 26th of October. For more information and to register, please get in touch with the synagogue office. As a result of having a Shabbaton, we're going to be having a Friday night panel discussion with a mental illness survivor. We're going to be having a wellness and meditation leader, as well as a therapist and medical practitioner, all as part of a panel discussion. We invite the entire community to this. And to kick this off, I'm here with Liz Wiener here this morning. And I'd like to talk to you, Liz, about the subject of mental illness. Liz is going to be on our panel. And I'd like to start with the subject of destroying the stigma of mental illness. There seems to be a fear, there seems to be a great sense of being standoffish to anybody that's suffering or currently going through a process or period of mental illness. And how do we take away that stigma?
Well, one of the ways we take away the stigma is by doing things like this Shabbaton on October 26th, is we talk about it. And the way to get comfortable with uncomfortable topics is to give them a chance to be out in the open. So the more we talk about mental illness, the less scary and dangerous and stigmatized it really becomes.
When I hear the word mental illness, there's two halves. Illness, anybody can get sick. And if a person, God forbid, had a serious illness, there would never be any judgment associated with that. If a person was to be admitted into the hospital with a significant virus or disease, I don't think anybody would feel that they were at fault for that. Yet, when you look at the first half of the phrase mental illness, when it seems to be an illness to do with a person's mental capacity, suddenly there's a change. It's almost as if we can judge that person.
Right, there's been this...
Why is that true?
Yes.
And why is that?
There's been this misconception, I think, that people who live with mental illness are somehow responsible for their illness. And you'll often hear people telling me, for example, I've lived with depression and generalized anxiety disorder my whole life. Go outside, get some fresh air. You're not taking care of yourself. Or this is my favorite one, is just you need to check on your perspective. Why aren't you grateful for the things you have, as though there is some control? But just like you can't control heart disease or you can't control thyroid disease, you can't control mental illness. You can manage it, certainly, but it's a chronic illness like any other illness. I like to think of it as a disease of the brain, and when I think of it that way, it seems to lend more legitimacy to the topic at hand.
Do you believe that there seems to be just an increase in the general population's sense of anxiety today, feeling overwhelmed, thoughts or feelings of being seasonally affected in terms of our mood? There seems, in my perspective, to be this sense that so many people today are struggling with these issues.
Absolutely. I think that we all walk around with computers in our pockets, which make us accessible 24/7. So we have this feeling of needing to be constantly on. We're also a generation of parents who feel the need to helicopter around our children a little bit and not letting them make their own mistakes and take their own chances. And it ends up combining that with our careers and our families and our friends. It's a tremendous toll on our mental health. And there are ways to manage it. But I think a big part of what we are experiencing definitely has to do with smartphones.
As you're speaking, I'm immediately thinking of Shabbat, because I think we miss a sense of balance in our lives We are always on the go. We are always seemingly running, accessible, doing. Where do we carve out time to be stopping? How do we find a way to withdraw from this world?
Well, it doesn't happen magically, and that's one of the wonderful things about Shabbat is it's a chance to rest, to put your phone away, to not check on your emails, not be text messaging, and not be on social media. I think it has to be a concerted effort to say, for the next hour, I'm going to take care of myself, I'm going to put my phone down, and I'm going to read a book.
Mm-hmm.
It's really about practicing self-care and practicing self-compassion, being good to yourself.
But there is a difference, I think, between what is a generalized sense of anxiety on the one hand and mental illness on the other. Could you elaborate or speak to that point?
Well, we all struggle at different times in our lives with anxiety and stress, and those two things can actually be motivators to help us get things done, to step outside of our comfort zones, to do all kinds of different things. It's normal to feel stressed or anxious about particular situations. When you live with anxiety on a constant basis, that can be debilitating, that can lend itself to you being not functional, to stopping yourself from doing the things you enjoy on a chronic basis, that's when it crosses the line into a mental illness.
Mm-hmm. I think it's very important for me in the capacity of a rabbi to know my own limitations and boundaries when a person comes to me with some of the symptoms that you've been describing. Oftentimes it is counter helpful to say, make sure that you go for a walk outside. Make sure that you're able to, have moments where you can have quality time with the family. There are certainly times where a mental health professional needs to step into the picture, and good advice simply isn't going to help such an individual.
Absolutely, and something that's very helpful for people who struggle with an anxiety disorder or depression is something called cognitive behavioral therapy, which is all about reframing your thoughts. When you live with an anxiety disorder, you are always or often projecting to the worst case scenario. So whatever you do, whatever you're thinking, it is the worst possible outcome. So cognitive behavioral therapy asks you to challenge those thoughts, to find proof for the negative thoughts. And 99% of the time, there is no actual proof. So that's a very helpful strategy. But the things you said, getting fresh air, taking some time for yourself, going for a walk, even practicing gratitude, those won't cure mental illness, but they can certainly help you manage it.
Mm-hmm. Thank you very much.
Thank you.
Thank you. If you would be interested in attending the panel discussion, I highly encourage you to do so. This promises to be a very important, enlightening, and an engaging conversation that our community is ripe to have. We welcome all of you to attend on Friday night the 26th here at Beth Tikva.